Hello, and welcome to another episode of Joe and Kat Chats. Oh my goodness. We are on episode 28. We're talking about health communication and vaccines this week. How are you, Joe? How's life?
You know, Catherine, I'm staying black, staying hydrated, moisturized, and spiritually uplifted. That's how I am today. That's what it is. That's what we're going with today. Yeah, me too. Me too. How are you?
Yeah, I'm doing well. Settling into my new digs here, and feeling good. I'm feeling a renewal from the solstice. I took some time and just, sat with myself, and that was really nice on the solstice. So that was good. So today's episode, I just wanted to mention, is sort of a follow-up to last week's episode. So if those of you who are watching have not seen it, please go back and take a look at last week's episode. Because this week we're talking about health communication and vaccines. So more vaccine talk.
Absolutely. And as we like to do, we like to make sure that we start off the show with a little bit of perspective. And as you probably already know, I like reading my share of books because I'm a well-educated brother. And currently reading this book, my beloved daughter Parker bought this for me for Christmas. The name of the book is called America, the Farewell Tour by Chris Hedges. Chris Hedges has written a bunch of books. War is a Force That Gives Us Meaning, American Fascists, Days of Destruction, Days of Revolt. He's a brilliant writer. And I want to read a paragraph from this book because it's going to not only set the tone for today's conversation to a certain extent, but it also proves to be rather clairvoyant, because this book was written in 2018, and here we are 8 days away from the end of 2020, and Mr. Hedges wrote a lot that's in this paragraph or so that I'm going to share with everybody that proved to be absolutely prophetic. So here we go. Now, he speaks about a philosopher named Gramsci. Now, here's what he says. He says, Gramsci would have despaired the divide in the United States between our anemic left and the working class. The ridiculing of Trump supporters, the failure to listen to and heed the legitimate suffering of the working poor, including the white working poor, ensures that any revolt will be stillborn. Those of us who seek to overthrow the corporate state will have to begin locally. This means advocating issues such as raising the minimum wage, fighting for clean water, universal health care, and good public education, including free university education that speaks directly to the improvement of the lives of the working class. It does not mean lecturing the working class, and especially the white working class, about multiculturalism and identity politics. We cannot battle racism, bigotry, and hate crimes, often stoked by the ruling elites, without first battling for economic justice. When we speak in the language of justice first and the language of inclusiveness second, we will begin to blunt the proto-fascism embraced by many Trump supporters. So what he's saying that is, hey, you know what? The working class and the anemic left, they're useless. And we're seeing that more than ever with the most recent passing of the stimulus package in the United States. And when we talked about so many of our previous episodes, we've talked about racism in the very first episode. And I think I said verbatim, racism is a function of economics. I said that verbatim. And when he says here, we cannot battle racism, bigotry, and hate crimes, often stoked by the ruling elites, without first battling for economic justice. When we talk about economic justice, Catherine, you and I have had two wonderful episodes about reparations. Reparations is the very definition of economic justice. Yeah. We spent quite a bit of time talking about From Here to Equality, the plan for Black reparations for Black America by Dr. Sandy Darity and his lovely wife, A. Kirsten Mullen, where it talks about our plan for reparations in the United States. Again, if we were going to talk about racism, if we are going to talk about the fights for humanity, freedom, equality, and survival, all of that is rooted in economics, because when you think about economics and some of the conversations we've had, we talked about colonialism and how that's a function of economics. We talked about capitalism, which is an entire system based on economics.
Yeah.
And all of the bullshit that came as a result of capitalism, colonialism, and racism. It's all rooted in economics.
Yeah, I agree with you for the most part. I think that economics is the driver of a lot of these inequalities that we talk about, a lot of these oppressions, and it's the basis of how we conduct everything, business, institutions, like public, private, all of the things. And so it's such a major part of our lives that it is something that feels like it's all of everything, I would argue that it's not necessarily, but in the current system we hold, I would agree with you. Everything kind of comes down to economics, and the inequalities that are being perpetuated and for years and years and years and years. And we, like you said, we've talked about this a million times and in a million different ways. Today's is no different. Health is really tied to economics, particularly in the US, but in Canada as well. It's innately tied.
Absolutely. And we've done 2 episodes about the healthcare system of the United States, and the common theme that I continually bring up in the United States and many of my other conversations on my live and direct chat series is that the healthcare system in the United States is tied to employment. Mm-hmm. Employment sounds like a function of economics to me.
Absolutely.
Because when you work, you make money, and when you make money, you contribute to the economy, and that is a function of economics.
Yeah, exactly. Yeah.
And if you don't have a job, you don't have healthcare, and if you don't have a job, you can't contribute to the economy, which is why we need our governments to contribute to our economic viability through different relief packages.
Yeah, exactly. Yeah, for sure.
Yes, ma'am. Yes, ma'am.
Yeah. Oh my gosh. So yeah, as we move forward today, there's so much to talk about. This is sort of just reminding me of all the stuff we've sort of mentioned. But before we move on, I just wanted to clarify something, because I do encourage everyone to go back and listen to last week's episode, because we talked about vaccines. It was sort of the starting point of this conversation or this topic idea. Right. But near the end, I just wanted to clarify. I was running out of time and I was sorting out my thoughts. But I want to just make it clear that we are not discouraging anyone from getting the vaccine. We're just providing the history of this stuff and the issues that exist in the current system, correct, including the economics, which we're going to get into today, particularly. You can make that decision on your own, whether you want to get the vaccine or not, because in our countries, they are not mandated. That could change. But personally, after doing a little bit of research, I do think that the vaccine is safe for everyone who does not have an allergy or any pre-existing conditions that could be affected. So just wanted to be clear about that.
And we are crystal clear on the Joe and Kat chat series.
Yeah, exactly.
Waterford crystal.
Yeah.
Crystal clear.
Yeah, so getting into the health communication stuff in true form, do you want to start out with a definition of health?
We will. The definition of health is the state of the current state of well-being, not just mind. It's mind, body, spirit, physical, emotional, and health is also. It's all of that stuff I just talked about, and it's also not just defined by an absence of illness. An absence of illness. So health, mind, body, spirit, physical well-being, complete well-being. Also takes into account that it's not just the absence of an illness or some sort of infirmity.
Yeah, exactly. And putting that with communication, which is the symbolic sort of exchange of shared meaning and understanding, and all communicative acts of both a transmission and ritualistic component.
And in our communications episode, and then we talked about this, we talked about the triadic model of communication, where it's receive, decode, recode, back and forth. We talked about that. So that's also important with regards to communication. And I know another definition we want to provide to everybody is a definition of a vaccine, because we spent so much time talking about it over the past episode and 9 or 10 minutes now. And a vaccine is essentially a biological preparation that provides immunity for a population. So right now, given the conversation we're having right now in context, we're talking about the COVID-19 or coronavirus vaccine. And there's a bunch of different pharmaceutical companies that are providing this vaccine to many of its citizens. Some people have already been vaccinated. Others are waiting to be vaccinated. So we want to make sure that that people understand what a vaccine actually is, because people use these words. Oh, what's a vaccine? But we don't know actually what it is. So now you know, and knowing is half the battle.
Yeah, totally. And in particular, when we're talking about the COVID-19 vaccine, it's actually an mRNA vaccine, which means that it sends a genetic code to your cells to direct them to produce proteins that trigger an immune response. And so what that means is it's really, it's actually like a more direct way of getting your own immune system to fight off the virus if you actually catch it, rather than other forms of vaccines that have worked in the past, where they basically just weaken the virus itself and then inject it into you. And so the weakened virus just sort of takes over your body in a weakened way so that your immune system can fight that off. And so there's a lot of talk online about these mRNA vaccines and what they're made of and all the things, but they are made of safe materials and they have been researched for many years. So yeah, I think that's just a little tidbit I thought was interesting and important.
All right, Dr. Wells, thank you very much for that. I was not expecting that.
Yeah,
mRNA. Wow. Okay.
Yeah, I just thought it was interesting, so I thought I'd include it in my notes. So
yeah, I didn't know about that. Straight up, I didn't know about that. So that's good stuff. Thank you.
Yeah, you're welcome.
Awesome. And obviously, as you so eloquently stated, when we talked about a vaccine, and we're talking about today's episode, health communication and vaccines. Now, we talked about the definition of health. We defined what that is. We defined what communication is, transfer and understanding of meaning. We talked about what a vaccine is, but health communication has its own definition. And health communication, it's shaped by personal goals, and it's shaped by personal beliefs and attitudes and ideas and consideration of one's feelings. Now, when we talk about health communication, there are 3 phases or 3 types of health communication. You have a biomedical framework of health communication, which takes into account health being a medical situation, health being fixed by physical means. You have a biopsychosocial framework where health is taken care of by physical means and psychological means. And then you have a socio-cultural perspective where health is looked at from a societal perspective and from a cultural perspective.
Mm-hmm. Yeah, that's really interesting. The way I sort of put those together was the biomedical is sort of like the doctors. Like you have to learn how to read the science in that health communication. So that's why we rely on experts to relay that information. Yes. The biopsychosocial, I feel like, is the people who can sort of interpret that and then make it understandable for like all of the public. And then the socio-cultural is like the people on the news talking about it. Like they're just regular people that are doing research and talking about this stuff because other people have sort of decoded it for us. And they're including things that are cultural, like you mentioned. So I thought that was a cool way of sort of breaking it down.
Exactly. Now, something we talked about in the language episode, we talked about the 3 ways to interpret. And we said that there are three ways. You could interpret interlingually, we could interpret intersemiotically, like sign language, semaphore, braille, etc. And then we could interpret interculturally. Interculturally, interlingually, intersemiotically. Now, when we talk about communication and being able to communicate not only between different people who speak the same language, but people who speak different languages, well, there are barriers to being able to communicate. Because again, this is about an episode about health communication. There's filtering. Some people might just take some of the information and filter it through certain channels in their mind, like, oh, you know what, yeah, I like this, I don't like this. And then you may not necessarily be able to understand all of the concepts that are being communicated to you. There's selective perception. Again, somewhat similar to filtering, where you look at something, it's like, you know what, this fits my belief system, or you know what, this doesn't fit my belief system. So there is some of that. We see a lot of selective perception with regards to the political conversation.
Absolutely.
It's like, hey, you know what? Yeah, I believe in this. I don't believe in this. I'm in my silo, so I only believe what I want to believe, and I'll shut out all the other opinions that I don't want to hear.
Yeah.
Selective perception. Information overload. Just too much damn information that's coming your way. It's like, oh my gosh, how do I process all of this? How do I process all of this? There's emotions. Sometimes emotions can get in the way. There is an Indian philosopher, I forget the Indian philosopher's name, but he said the highest form of human intelligence is to evaluate without judgment. Evaluate without judgment. And judgments tend to involve emotions. And emotions can get in the way of effective communication. Think about when you're with a significant other. You argue, you fight, you cuss, you scream, you shout. And all these emotions get in the way, and you forget what you were actually arguing about. Emotions get in the way of effective communication. Language, that's an obvious one. If you and somebody else speak a different language, if they speak Bosnian, and you speak English, and you don't know Bosnian, and they don't know English, good luck communicating. Silence. Some people just can't talk because they're mute, or don't understand the symbols of communication. So, for example, if they're not able to hear and you're speaking to them, well, that's a barrier to effective communication. If they are blind and you can see and they can't see your hands, that's a barrier to effective communication. And the other barrier to effective communication is apprehension. Some people just don't want to talk. Some people are just reticent. They're shy. They don't want to be around other people. They're not, you know, they get uncomfortable when the room is Zoom. It happens. So sometimes some people just don't want to talk. They're nervous. And that's another barrier to effective communication.
Yeah, and I think that even just like uncertainty or not being confident in what you're saying is also a barrier too.
Absolutely.
And along with one that I added to that list, just when you were going through them, is trust. I think that trust is a big, thing with communication. If you don't trust someone, maybe you will be silent or apprehensive, or you might select or filter what you're saying. And so I think trust is a huge one.
Absolutely. It is a huge one. Now, part of effective communication from a patient-provider perspective involves informed consent. And we're going to have a whole lot of informed consent when we talk about getting these vaccines. And informed consent is basically a medical professional letting you, the patient, know of all the risks, benefits, and anything that could possibly happen regarding your health treatment. So if you get an allergy to this vaccine, you should know about it. If you get sick because of the vaccine, you should know about it. If the vaccine has a 98% efficacy rate, but then 2 people don't get any benefits from the vaccine and they get sick and die, you should know about that, because that is informed consent.
Yeah, absolutely. Yeah, and with the vaccine that's coming out right now, the 2 that are approved in both the US and Canada are the Pfizer BioNTech and the Moderna. Right. Those both have a 90% effectiveness rate in most populations. And we can talk about the most asterisks, most populations later. It goes down to 84% in seniors, and trials have not started in children yet. And then there's also issues with race and particular vulnerable and marginalized populations too that make those numbers a little bit different. But yeah.
Now, there's something else that I want to make sure I discuss because it's also important, and this is from the provider perspective. Providers at times will employ a particular I don't want to use the word tactic, but a particular communication strategy, and it's called therapeutic privilege. Therapeutic privilege. Now, therapeutic privilege is somewhat related to one of the barriers of communication I mentioned earlier, the third barrier, which is information overload. Now, therapeutic privilege happens when a caregiver communicates with a patient and purposely holds back some of the information because too much information might do more harm than good to the patient. So there's a fine line between informed consent, therapeutic privilege, and just flat out negligence. Which you as a caregiver, you want to make sure that you're providing all of the information to the patient as necessary, but you don't want to overload the patient to the point where they're not clearly communicating with you or understanding everything because of information overload. But at the same time, you, the caregiver, don't want to get to a point where you water down the information to the point where the patient doesn't understand all of the risks and benefits of the treatment that's being prescribed.
Yeah, that's really interesting how there's sort of a subjective aspect of this where there is that sort of fine line between where, whether you're negligent or being, providing informed consent. That's a really interesting point.
Yeah. And when we talk about the healthcare system in the United States specifically, many caregivers, because of the litigiousness of our society, employ a type of medical care or a practice of care called the defensive practice of medicine, where in many instances, caregivers will do just enough so they won't get sued by their patient, or they can't get sued by their patient. And so instead of administering medical care and having actual clinical care being the focal point of the clinical encounter, in many instances, the clinical encounter focuses on making sure that they don't get sued and taken to the cleaners with a malpractice lawsuit, which completely shifts the focus of care.
Absolutely. And I think that's a really interesting point too, because it plays into every aspect of the healthcare system, including these pharmaceutical companies that are private, that are getting these government contracts to do research and to do whatever implementing of this vaccine that is coming out. And so, I mean, that's really what ties it back to what you were talking about right at the start of the episode, economics. This focus on the economic aspects of health shifts the way we get care and the way we understand care and the way that we're going to interpret, communicate about all of the things. And that's that is an impact to your health, which is a huge impact. That shift is or that perspective or that lean on economics is a hugely impactful or important way that we need to be examining the healthcare system and health communication and everything around it.
Exactly. And when you think about the differences between your country and my country, your country has a government-managed healthcare system. And it stands to reason that Canada's health outcomes are considerably better than the United States. The United States, we have a for-profit healthcare system where the focus is making money. And it's really not even a healthcare system. Former presidential candidate Marianne Williamson said that America does not have a healthcare system. America has a sick care system. where we focus on making sure that people are just well enough so they're on the borderline between being well and being sick, but they're never actually truly healthy people.
Mm-hmm.
And making sure that health is an important factor in people's lives also affects a terminology we defined last week, your socioeconomic status. You can tell a lot by through someone else's socioeconomic status as directly related to health. So there's a lot that we need to just continue on with our discussion about this episode. And when we talk about having health objectives communicated to us, we also need to be able to understand what those objectives are. And that is defined, the very definition of health literacy. And health literacy is basically your ability to understand health information as it is being provided to you. But it's not only the ability to understand the information, it's the ability to access the information. But once you have the information and you have access to it, you have to be able to apply it. You have to be able to use it. And we talked about in last week's episode a bunch of different ways you can access it: mHealth, telehealth, eHealth. You have e-patients, of people who use the internet to get health information about their medical care. So mHealth, we talked about a variety of different ways that people can access health. And being health literate is important because there are going to be loads of terminologies, loads of words that are going to be used in context with this COVID-19 vaccine. There's a whole lot of terminology that people just don't understand, which is exactly why we are doing this episode. But we also want to make sure that you have access to this information, so when you go to your caregiver, you're an informed patient.
Yeah, which is so important. And I think being proactive like that is something that we all need to be able to do. And it's really hard because a lot of health information is really complex and hard to understand, like you said. So
Exactly.
Yeah, so that's why we're doing this.
Exactly. We want to break it down for the people.
Yeah.
We want to break it down for the people. We want to make sure that everybody understands what we're talking about. Now, some aspects with health literacy that are important. Number one, language understanding. You got to be able to understand what these people are talking about, which is why we did an entire episode on language, and we talked about interpreting, translation, especially with health information, because when you talk about health, the health interpreter has to be at times a cultural broker, at times just this computerized language translation interpreting machine, but they also at times have to be an advocate for the patient that they're interpreting for. So it's a very delicate balance. You also have to have access to reliable and relevant information. It doesn't do any good talking about a vaccine that was from 1958 when we're in 2020.
Yeah.
Good as that. You have to have an interest in health-related information, because being interested in something means you're more likely going to take the steps necessary to promote positive health behaviors. Adequate hearing and or vision. That's useful. Got to be able to see and hear what they're talking about. And if you can't see or if you can't hear, the caregivers, at least in the United States, are required by federal law to make sure that those particular disabilities are remedied through the proper means. So if you're blind, you better have some Braille. If you can't hear, you better have somebody that understands American Sign Language.
Yeah, it's the same here in Canada.
Yep. You also need to be able to apply the information. What good is having the information if you can't use it? Apply it. And then you have to be willing to use the information. You know, it's like, yeah, I got this information now. I know about the pros and cons of this vaccine. Okay, how am I going to use this information? Let's say I work for a health department and I have this information. I'm willing to have this information. How do I share it with people? How do I communicate these objectives? All of that is important when you're talking about health literacy.
Mm-hmm. Yeah, absolutely. Oh my gosh, that was so much information and all just like really important. So thank you for that. You're
very welcome. And you know, and this is why part of the reason why we're doing this episode is because we want to make sure that we're communicating with everybody. And when we talk about communicating, there are different levels of interaction. We have social networks and we have different levels of social interaction because, you know, there are some people that you communicate with more than others. And there are three, and this is a theory, we call it the three spheres of social interaction. You have your personal sphere, which is your closest people, your homeboys, your homegirls, your home skillets, your close people, the people you're tight with, the people you tell your secrets to, right? Then you have your technical sphere. And the technical sphere is basically communication where there's an agreed upon set of rules on how to communicate. You typically have a technical sphere of communication in the court system.
Okay, yeah.
In the court system. All rise, Your Honor. You have it in parliament, in parliamentary procedure or in governmental procedure. Motion to suppress, different types of motions, passing different types of legislation. There's a way to communicate when you're in parliamentary procedure. One of the books that I had to read for the first master's degree, I had to read parts of it, is a book called Robert's Rules of Order. Robert's Rules of Order. It is one of the most boring books you will ever read in your life. And it is absolutely one of the most useful books you will ever read in your life because it discusses the parliamentary procedure. And when we talked about the voting episode, one of the aspects we talked about in the voting episode was the Condorcet system of voting, otherwise known as ranked choice voting. Ranked choice voting is discussed in Robert's Rules of Order.
Nice.
And the third sphere is your public sphere. And a perfect example of that is us. We're doing it now. Yeah. We're talking to everybody. And it's information that could affect the public in one way or another. And it's conversations about global issues or community issues. And I would certainly think that a pandemic, and by definition, a pandemic is global, and it's certainly an issue. This is a public sphere conversation.
Yeah, absolutely. Yeah, and even bringing it back to the health specifically, like the technical sphere of interaction is any job that you do that you have to learn sort of terminology for, which includes like doctors, medical staff, all of that, and those people have to do both in most of their interactions because they have to understand the technical side and then be able to disseminate that into the like public language, the common language that most people are going to understand. And if they don't, they have to re-communicate that to patients in that sense. So yeah,
that's important. It's absolutely important. It's absolutely important because again, when we're discussing the way you communicate with people, people have to again, the very definition of communication is a transfer of meaning and understanding of meaning. And if you, the caregiver, can't convey that meaning to the patient, then you really haven't communicated with that patient at all.
Yeah.
What good is talking to somebody when they don't understand what you mean?
Mm-hmm. Mm-hmm. Yeah, and there's examples. I just sort of, it made me think about examples of when communication has a barrier in the healthcare system.
Absolutely.
That's when the care can sometimes go down because there are many stories of folks, and I think I talked about it before in one of the episodes. I can't remember which one, but there was, a person in, the ER waiting room that was not able to communicate. So they were not looked after for several hours and ended up dying from some complications from a pretty easily avoidable thing, like medical condition that they were going through at the time. And so, so communication is such an important thing in the medical field and all around. And the added layer of race and language and immigration, refugee status, or what I mean? Like there's all these added layers that can break communication down and make it so that the healthcare part is not working.
Yes, and that's exactly why when we talked about interpreting, we talked about interlingual and intercultural. And when you talk about immigration, refugees, asylum seekers, there's obviously a cultural barrier that has to be overcome. And that's why I literally 4 or 5 minutes ago, I said, when you're doing healthcare interpreting, yes, at times you have to be an advocate. At times you have to be just this translation or interpreting robot. but at times you have to be a cultural broker. You have to be able to understand the culture of who you're interpreting for and relay that culture to the caregiver. So you truly facilitate communication, which is the transfer of meaning and understanding of meaning.
Yeah, absolutely.
Yep. Yeah, and something else I mentioned with respect to communication, I said a social network. And there's an actual theory behind this, the social network theory. And the social network theory talks about those who you have strong ties to or strong connections where the connections in a social network overlap, or those you have weak ties to where you don't have as many connections in a social network, or you hardly have any connections in a social network. I forget which book I read this in. I think it was either Malcolm Gladwell Outliers or The Power of Habit by Charles Duhigg. And by the way, one of the future episodes, we're going to talk about that book, The Power of Habit and Racism, or I guess anti-racism. And I think in the book, it talked about a job interview where in terms of getting an interview and getting connected to a job, the weak ties were more important than the strong ties. Because the strong ties, they knew they kind of knew all of the personal aspects of the person trying to interview. But the weak ties didn't necessarily know everything about the candidate for the job. They only knew about just the candidate and that particular person's skill set. There was no emotional involvement in it. So in many instances, if you're trying to, for example, do some sort of job networking, in many instances, your job networking is a whole lot of weak ties rather than strong ties, because a lot of the times you're on LinkedIn and you're sending messages to people who you really have not much of a connection with, or based upon LinkedIn's connection hierarchy, you might be a second contact or a third contact, which means you have hardly any connection to this person you're trying to speak to at all, and that's the very definition of a weak tie.
Yeah. Yeah, that's really interesting. And that's reminding me of social capital and cultural capital theories as well, which are really, related to this social network theory.
Correct.
In the sense that, there's the strong and the weak ties, and depending on how strong or weak your tie is to people, that is a really big factor in being able to recover or receive, benefits or any sort of help when a disaster happens, or in this case, a global pandemic. So if you're like in a community that already has, ties to each other, you know your neighbors and all these things, you're probably going to be doing better because you're all going to be looking out for each other.
That's an excellent point. You are going to be doing better because you're looking out for each other, and that's sort of solidarity. Oh, remember that word?
Absolutely.
Solidarity is needed now more than ever, because something that I consistently have talked about, I mentioned it today. We talked about the anemic left in the beginning of that Chris Hedges book, how government is essentially failing us. So now more than ever, we need more community mindedness.
Mm-hmm.
In the book that I mentioned there, he talked about must be able to work on a local level.
Yeah.
Movements must start on a local level. It's that exact sort of groundswelling and grassroots movement that's needed now more than ever, and that sort of community support that's needed now more than ever.
Yeah.
And
Go ahead. Oh, sorry.
No. What I was going to say was, and with that community support, mm-hmm. and being able to communicate to people in a community on either a small scale or a mass scale or a large scale is mass communication. Mm-hmm. It's basically being able to disseminate a message using various types of media. And the types of media can vary. It could be a TV, it could be internet, email, website. It could be a text message. It could be radio, whether it's FM or XM, otherwise known as terrestrial radio or satellite radio. Or it could be a newspaper or a magazine or a bulletin or a journal or a flyer around the post at a local grocery store. Mass communication.
Yeah, I mean, it shows up in all sorts of different ways. I think we're sort of used to using, internet sites or news sites or television or radio. Those are kind of the main ones that stick out. But there's so many different ways to disseminate all of this knowledge and communication if you need to. And what I was going to say before was just this is reminding me of just how many of the sort of activist circles I run in, the emphasis right now is really on community care and really building that. And that's really, I think, what we've been promoting through all, 27 previous episodes of
Absolutely.
Don't Catch Ads. And so, yeah, like solidarity and community care are these sort of seemingly buzzwords, but they have substance behind them. And that's what makes me excited about these conversations every week, because we are building, we're communicating and building solidarity, building community care through all of this.
Yes. And we're doing it using various types of media in a mass communicative type of way. And eventually the podcast will happen and we'll get the podcast going and we'll be able to, if you want to watch us, that's perfectly fine. I mean, we're both attractive folk. But if you want to hear us, that's also another way that mass communication applies. And something you mentioned, and you said, hey, you know what? With all of this communication and all this information, we have to be able to understand it and evaluate it. That is the very definition of media literacy. Media literacy. Because just as health literacy involves certain skills or certain pedagogies that are involved with understanding how to be health literate or how to be literate in general, being able to read and understand the words on the piece of paper or on a screen. It's no different than with being media literate. It's being able to evaluate what information is out there, how useful is it, and how realistic is it? Do I need 4 shots for a vaccine? I don't know. Do you? Is this vaccine safe? Or does it cause autism? How do we know this?
Right.
Where is this information coming from? Is the information coming from reliable sources? Who does the fact checking for these sources? Who has the authority to fact check these sources when the dissemination of messages are communicated en masse?
Yeah.
How do we know that social media outlets like Facebook and Instagram are supposed to be trusted with media literacy? Who gave them the authority to be the gatekeepers of media literacy and health information?
Yeah, this is a really important point. And I think there's a lot to be said, but I think that is going back to sort of what we were talking about before through these, like the biomedical, biopsychosocial, and the sociocultural.
Absolutely.
And also through the personal, technical, and public spheres of social interaction.
Perfect.
Because there's people that we rely on as experts to be able to interpret this information and communicate it to us in a way that we understand. We've said that before, but I think it becomes a really interesting conversation when you're bringing in things like, the efficacy, the safety of something as new as this vaccine, because I think something I've been hearing a lot of with various people in my life is just that it seems like it's being approved so quickly, and that's making people uncertain about it,
right?
Which is totally fair, and that is part of the health communication that we're getting, and how this past year has been all of these ups and downs and ebbs and flows of communication, because everything was so uncertain for so long that we were getting information and then it would be the opposite, within a week or 2 or 3.
Right.
So yeah, I think that's a really important and I mean, I don't think we're going to be able to solve that conflict and uncertainty, but we can definitely talk about it.
Right. And again, I mentioned the 7 barriers to effective communication, and the last barrier that I mentioned was apprehension.
Right.
And the same sort of apprehension that people had with the vaccine is there's probably a positive relationship between the apprehension to being communicated to from the caregiver to the patient, or vice versa. Because if the caregiver if the patient is apprehensive, it doesn't really want to talk, then how can the caregiver effectively communicate with the patient? And then naturally, the patient's going to be like, well, I'm not sure I want to take that vaccine. Well, again, part of being not wanting to take the vaccine also comes from getting the information and evaluating the usefulness of the information and the realisticness of the information, which is health literacy. So it all ties together. So if you have a communication barrier and you're apprehensive, and one of the barriers is apprehension, and you're apprehensive about the vaccine, but then on the other corner of your mouth, you're like, well, I don't know a whole lot about this vaccine. I'm not sure I want to take it. Well, no shit. There's a reason why you don't know much about it, because you were apprehensive with the communication process when someone that had reliable information was trying to communicate it to you, but you didn't want to hear it. And now you don't want to take it.
Yeah, and that's such a good example. And even to make it more broad is like, like this applies so much more broadly, because like if you don't trust your government, guess who's funding all of the research? The government right now. If you don't trust the economic system we live within and these companies that are doing the research, then you're not going to trust the vaccine.
Nope.
Like that, because the vaccine is the outcome of this already strained or relationship or communication barrier that you've that you already mistrust. And so so there's like so many layers, both in an interpersonal way, like your example, and even just in the broader social context and cultural context.
Exactly.
Of all of this.
Exactly. And when we talk about some of the previous episodes, one of the episodes we talked about was Wall Street and the White House. And this is going to be somewhat tangentially related, but it's going to make sense. When we talked about Wall Street and the White House, we talked about the level of corruption in the highest levels of the government. And you so brilliantly brought this up about 45 seconds ago when you said, you know what, who's funding the research? The government. If you don't trust the government, you don't trust the vaccine. There's another aspect to all of this with community care that I meant to bring up, but I just didn't bring it up because you were in a flow and I don't want to stop we don't want to stop when you're in a flow. You know what I'm saying? We don't want to, trains are on time, the smoothies are on time. When you're on the zone, we don't stop. Okay?
Yeah, that's how we do.
That's how we do it. But something we wanted to talk about with regards to community care is social capital. Social capital. And the B side of that record of social capital is goodwill. And it's difficult to build up that level of goodwill when there's already an inherent and intrinsic mistrust and distrust of the government.
Yeah.
And it's difficult to build up that sort of social capital with respect to community care when you may have a certain amount of dissension in the culture, or people who don't adopt particular roles in a culture, and the social fabric of that social network, of that community, breaks down and disintegrates. It's quite similar to the disintegration of society that we're seeing right now, when we see institutions disintegrate, when we see healthcare not being administered to everybody, when we see an economic system in complete free fall and collapse. There's a sociologist named Emil Durkheim where he talks about anomie, ANOMIE, where it's a system and state of lawlessness. Everything's just all over the place. And it's directly related to what we're talking about right now.
Yeah, absolutely. I think that this is a way for us to be able to break down sort of what the layers are. And I love having these conversations because it's so we can use a interpersonal example like you did between patient and healthcare worker,
Correct.
and really demonstrate that, like, if your communication isn't there, you don't, it's not working. But it
Exactly.
does go up all the way to these large institutions and systemic things that we also talk about often on these chats.
Sure
And
enough.
so, yeah, I mean, it's I don't know. I have a lot to say, but I feel like I haven't sorted out my thoughts yet.
No,
So.
no, it's all good. It's all good. It's all good. It happens. It's 2020. Not everything is as neat and clean and as organized as we'd like it to be. We're allowed to be a little sloppy. We're allowed to, wear pajama pants to the grocery store. It's no big deal.
I mostly just got excited that you brought up a sociologist, because that's what my degree's in. I was like,
Oh my gosh, Emil Durkheim, yes. Yay. I knew it. And a couple more things, because we're not running out of time, but the sand in the bottom of the hourglass is filling up. Something else that we want to talk about with respect to the whole vaccine and health communication is a health promotion campaign. And it's essentially an endeavor to make sure that health is being shared, health enhancing behaviors are being shared in a systematic way. And there's a bunch of different health promotion campaigns out there. You can have one, for example, on the internet. For years ago, we had these after school specials that said, hey, this is your brain. This is your brain on drugs.
Totally. Yeah.
You can have health promotion campaigns that kind of go in the opposite direction. So, for example, a lot of years ago, cigarette companies were saying, "Hey, you know what? Let's have Joe Camel. Let's have a cartoon as our character to promote smoking."
Mm-hmm.
And then many health communicators were saying, "Well, hey, look, the smoking in young people has increased because there's a cartoon that people identify more. People know Joe Camel more than Mickey Mouse. Wait a minute, that's not cool. That's an example of a bad health promotion campaign, because smoking is bad for your health. Let's make sure that we try to do something so we don't promote Joe Camel as much as we do Mickey Mouse." So it can kind of go both ways.
Yeah, for sure. Yeah, that's really interesting. This is making me think about sort of something I've been working on, which is the Ebola epidemic that happened in 2014, 2015 in Western Africa.
Right.
Yeah, like most people probably remember that. It wasn't too long ago. So like the communication campaigns didn't work because the people there, the perspective was that those campaigns were coming from like the white people. They were coming from elsewhere, so they didn't trust it. They didn't have trust in those ways of communication. And so there are ways, or there are times when these utterly fail, and that was one of them. And what to sort of go full circle here, what really ended up starting to work was the community care. The leaders and the survivors of Ebola got involved in all these different communities. Particularly, this began in Liberia. And that's when things started to shift and people's perspective changed, and all of these health practices, behavioral changes started happening, where people were washing their hands more. People were not touching as much, to shake hands, say hello, kissing, hugging. Those things started to shift. And then people started to see the actual like Ebola virus not being as rampant or infecting as many people. And so they realized, like, they were seeing it with their own eyes. And so I think that's sort of a really applicable example for this conversation right now, because we're going through a global pandemic.
Absolutely. And in many instances, with regards to the Ebola virus back in 2014 and 2015 in Western Africa, and most of those countries in Western Africa are Francophone-speaking countries that were formerly colonized by France. And we talked about that in the capitalism and HDI episode. I think it was episode 18 or 19 or something. But with respect to the Ebola virus, we talked. You met, as you would kind of didn't mention it directly, but it's social capital again. It's getting people from your community to communicate those health objectives. And another one of those health objectives, and we want to make sure that we remind everybody about this, is WASH, the acronym WASH. Water, sanitation. The original acronym used to be water, sanitation, and health. But most recently, the H has been changed from health to hygiene.
Mm-hmm. Yeah.
Water, sanitation, and hygiene. And you see that in a lot of humanitarian spheres. And what's interesting, you mentioned the health promotion, because there's actually 4 steps to running an effective health promotion campaign. And we're going to outline them now while we have in the last couple of minutes. Number 1, define the situation and analyze the potential benefits. Hey, you know what? This is good for you. It's good to wash your hands, because when you wash your hands, you reduce the spread of the virus and people don't get sick and die. That's a good thing. Next is to analyze and segment the audience. Who are you talking to? Who are the people? Who's your audience? When you segment the audience, you take out a particular group of people from the audience and you test them. You ask them questions, various types of questions, open-ended questions, closed-ended questions, etc. Number 3, establish campaign goals and objectives. That's self-explanatory. You do that with any type of endeavor. We talked about the particular type of goals that you set called SMART goals. We talked about that, I think, in episode, I want to say the protests episode, which I think was number 2, if I'm not mistaken, where we said
3, but yeah.
2 or 3, something like that, when we said SMART goals, specific, measurable, attainable, realistic, and time-based goals. Mm-hmm. You need them. And number 4, select the channels of communication. How are you going to communicate with people? Are you going to use, what good is using a Twitter campaign when everybody doesn't have cell phones or laptops?
Yeah.
Okay. What good is using billboards when literacy might be an issue? Mm-hmm. You have to be able to use different types of communication, different channels of communication. And given that the Ebola was an epidemic, you're obviously going to use different types of mass communication to make sure that you overcome a knowledge gap, to make sure the message has a certain level of penetration, and to make sure that the message has reach and has a particular type of arousal, that you feel something for the message. Because when you feel something for a message, the message is more likely to have a bit more meaning to you. Mm-hmm. And at the same time, you don't want there to be a whole lot of involvement in the message. And what I mean by involvement in the message, and involvement, it's specific with health communication. When you talk about involvement with a health communication in a health communication framework, it's the amount of mental energy used to understand the message. Mm. That message should be communicated so clearly that you shouldn't have to have smoke coming out of your ears to understand what was said to you.
Yeah, absolutely.
But at the same time, the message should not, the caregiver should not necessarily feel the need to use therapeutic privilege because the caregiver is not communicating effectively and overcoming those barriers of communication.
Yeah. Wow, that was really well put. Thank you. Oh my gosh.
Well, every once in a while I'll get it right. Every once in a while
all the time.
Right. Look, it is what it is out here.
Oh my goodness.
It is out here. It is out here. So we got about a minute left, Kat. First of all, I want to thank you for doing this. Episode number 28 in the books. We got about 60 seconds left. Please tell everybody what we got cooking for next week.
Oh my goodness. We're doing a wrap-up episode next week. So we're going to talk about all sorts of stuff.
Year in review.
Stay tuned. Yeah, year in review. Exactly. And Joe, my goodness, thank you as well. This has been so fun. And I wish we had more time because we always have a lot more to say. But for now, we'll have to say goodbye and thank everyone for tuning in. And Yeah, thank you.
Yeah, you're very welcome. We'll be back next week, another episode number 29, year in review. We're going to talk about everything that happened this year as much as we can. Protests, civil unrest, untimely deaths of people, famous people, and maybe not so famous people. But it's all important, and we're going to talk about it all next week. All right?
Yeah. So join us live. We'll post on our IG.
Yes, ma'am. Peace.
Awesome. Bye.
Bye-bye.